Gold participants and listeners from around the world. I'm Kristen Schwartz, licensed midwife and MC for Gold Learning. And I'm here today chatting with Melissa Cole. Hi, Melissa.
Hi, Kristen. Happy to be here.
It's so wonderful to have you here with me. And I know you have spoken for Golds before, and some of our listeners already know you. But for those of you who don't, can you tell us a little bit, where in the world are you located, first of all? Let's start with that.
Yes, absolutely. I am in the beautiful Pacific Northwest of the United States in Portland, Oregon, a few hours south of Seattle, and it is a beautiful place to live. We've had a few days of sun, but mostly it's gray and rainy. But other than that, I do think it's a beautiful place.
That sounds wonderful. We are in spring. Spring has just begun. So what is spring like in your
Well,
area?
besides bothering my allergies, we have so much flora and fauna. We have a lot of rain, which turns to a lot of greenery and blossoms, and it really is a beautiful time of year. My office is not too far from an area we call Forest Park, and we have a lot of natural resources and outdoor spaces here, so that's beautiful.
Wonderful. Lots of good things to do outdoors and be in
Yes,
nature. That sounds fantastic to me.
me too.
So you're going to have a presentation here for us at Gold titled Infant Oral Assessment, Exploring Anatomy and Function Beyond the Frenulum. And we want to definitely talk about that. But before we do that, tell us a little bit about your background.
Absolutely. So my background, even before I was interested in lactation and baby-related things, was in cultural arts and linguistics and culture, and I really have come at my practice from that background of being very interested in people's stories and where they came from and what they're going through. And this has translated well to the work I do with families. And my Bachelor's of Science degree is in maternal and child health and lactation consulting, and my Master's of Science is in therapeutic herbalism, and I've spoken with you about herbs in
Mhm.
another gold session. But we have, so much deep work to do with families. We're often supporting them on so many different levels that we sort of need to know a little bit about everything, don't we?
Yeah, absolutely. We do have to know a little bit about everything, right?
Yeah.
Yeah, so and this presentation on the infant oral assessment. So tell us a little bit about it. What will you be presenting on?
Absolutely. So I titled this about, function beyond the frenulum because I think that's where a lot of professionals get caught up. And it can be easy to have this myopic focus on the frenulum and what is the
Yeah.
frenulum doing and lose sight of the fact there's a whole other face attached to a whole baby. And we want to look at the big picture so that we really can give credibility and depth to the work we do. And so we
Mhm.
just don't want to oversimplify or overcomplicate certain issues.
Yeah. Um, you mentioned there looking at the frenulum, what is the frenulum doing? I mean, in recent year, we had a lot of
Mhm.
research done and a lot of wonderful
Yeah.
presentations and information on tongue tie. And do you see that? Is that like a resurgence in recent years? Has it always been like that, that we're looking at this topic
Yeah.
more now? Or is it just something that's because there's more information out there? What is your feeling about this?
Well, I mean, that is a big part of the work I do, both around
Hmm.
research, clinical speaking, teaching. I talk about this a lot, and it's a big part of my practice. I think,
Hmm.
many of us are looking at this topic more in depth. Um, and we know even in the last 2 to 3 years, a whole plethora of new articles, literature reviews, research has come out around ankyloglossia and frenula related issues. And so my point of this talk was to just go a little bit beyond that. Let's look at other aspects of oral facial anatomy so that yes, we're keeping the frenulum in mind and being conscientious about tongue tie related issues, but also factoring in other aspects of oral facial anatomy and function.
Hmm. So tell us a little bit what we will learn in this presentation then.
Absolutely. We'll talk a little bit about the embryological development of the
Hmm.
oral cavity and how that factors into function later on. We'll
Hmm.
talk about particular, certain anatomical landmarks. How do we look at the cheeks, the jaw, the tongue, the lips, the palate, and sort of compartmentalize them to look at them individually and then look at the bigger picture. Um, with only 1 hour, the sad part is we don't get into depth when what do we do when we discover problems. That will have to be
Right.
another talk. But with my other hat on, myself and other colleagues do teach extensively on that. And so
Right.
if it's something that piques a clinician's interest, reach out. There are many additional training opportunities.
Absolutely. And we do have the forum as well, the where the delegates can reach out to you and find out more about any trainings that you possibly offer or any resources that you know of, correct?
Absolutely. I love the Gold Learning Forums. We, get to chat with colleagues and friends around the world
Mhm.
and really find out what's happening in different areas. Good stuff.
Yeah, good stuff. And I like what you mentioned there about your presentation that you're looking at the baby. I liked how you worded it. There's a whole baby, there's a whole face
Yes,
attached to that area.
not just the
So
frenulum.
yeah, so we were looking at the at that as well as will you be discussing muscles as well? Facial muscles?
So, in a roundabout way, for just a 1 hour presentation, I did not want to go too deep into specifics. I wanted to
Right.
give not just, oh, can you name what muscle does what?
Right.
I wanted actually participants to leave with a sense of, hey, here's a few real-time, real-world things I can do today in my practice to check things out that I maybe have not been assessing. And so I do include some resources. If you want to learn about specific cranial nerves and facial muscles, there are so many books and resources
Mhm.
where you can learn to label and identify. I want to give listeners some take-home juicy stuff that they
Oh,
can
great.
actually apply directly.
Fantastic. I like the sound of it that we're getting some juicy juicy
Yes.
stuff that we can take into our practice
Yeah.
and use right away. I mean that is exactly it. Something hands-on that we could use
Yes.
immediately, and then also some good resources if we want to look into more research and information that's available to us there as well, correct?
Absolutely.
Wonderful. So, last question here, real quick. What are you hoping our delegates will take away from this presentation?
Sure. I'm hoping that they maybe identify one or two additional orofacial features that maybe they haven't been checking out in depth that they want to add to their assessment protocols
Mhm.
and think about a little bit more deeply. And also maybe they identify their strengths and weaknesses and figure out what additional training or information they need to be even a better clinician moving forward. And sort of identifying, what we need to know more about is a big part of learning.
Fantastic. Thank you so much for spending time here with me today and talking about your background and all the good things that we're going to learn in the presentation.
It's my pleasure. Thank you for having me, Kristen.
And to our listeners, the presentation on infant oral assessment, exploring anatomy and function beyond the frenulum, is part of the Focus on Foundation lecture pack presented by Goal Learning. And for more information on this presentation as the other presentations in the lecture pack, please visit goallearning.com. Thank you everyone for listening. Bye bye.